The University of Zimbabwe, in collaboration with the Africa Center for Disease Control, today hosted a groundbreaking 10-day mental health leadership program for mental health practitioners, the first of its kind in Southern Africa. This initiative aims to address the significant challenges mental health poses to individuals' well-beings. Our reporter Francisca Msheche attended this workshop.
Mental health continues to be one of the most pressing issues affecting individuals worldwide. Millions are impacted, yet the challenges remain hidden, often misunderstood. Meet Mbali Shongwe, a 25-year-old social activist from South Africa who has personally experienced the challenges of mental illnesses. Diagnosed with generalized anxiety disorder, major depression and PTSD, Mbali emphasizes that mental health issues are far more complex than often perceived.
But when I went into tertiary education and had more formative experiences that were more severe and serious, such as a sexual assault situation, I came to understand the real depth of mental health and mental illness and the effects that it has on somebody's trajectory and quality of life.
The lack of conversation is a major obstacle. According to a 2017 World Health Organization report on the mental health of women and girls, women are 3 times more likely to experience common mental health problems than men. Mbali's story is just one example of the many individuals facing similar challenges globally. Beyond the stigma and the lack of conversation, Mbali also highlights the crucial problem of limited resources and access to mental health care.
I think that mental health is naturally a very costly issue to solve, and so we need more people who are going to take up action and try to integrate approaches that are affordable, that are accessible to widespread communities, and that are palatable and safe for everyone to access. And so that's where my inspiration and passion behind mental health came.
The head of the Division of NCDs, Injuries and Mental Health at Africa CDC, Dr. Mohamed Abdulaziz, underscores that inadequate funding is the primary reason why mental health services are so neglected in many parts of the world.
But one of the main reasons is that we do not have enough surveillance data for mental health, and we are trying to see how we can improve surveillance for mental health disorders so as to guide our policymakers, the Director General of Africa CDC, the Director General of WHO, their member state ministers of health and ministers of finance to put in more money into the prevention and control of mental health.
A 2019 WHO report reveals that approximately 970 million people globally were living with a mental disorder, highlighting the alarming high prevalence of anxiety and depression. Psychiatrist Dr. Evelyn Makanza Mazike highlighted the critical shortage of mental professionals, a severe gap that hampers effective responses to the growing need for care.
As we speak in Zimbabwe, there's just less than 30 psychiatrists servicing the whole country. So we see the need to sort of decentralize. We can't concentrate on just the tertiary institutions. We need that integration of mental health into primary health care, into community health programs.
Globally, mental health is a critical issue affecting a significant portion of the population. In Zimbabwe, it is a growing concern, with various challenges affecting people's well-being. These challenges include stigma, limited resources, and lack of access to care. This has often led to high rates of mental health conditions and suicide among young adults and older populations. The urgent need for collaboration in tackling this scourge can never be understated. For ZTN Prime, I am Francisca Msheche in Harare.
Konapo, ipapo.